eating disorders can affect anyone. Am I correct?
That's correct.
All right. And eating, however, the most common groups are, as you say, common groups ethnically. Is there a difference between ethnics?
Okay. Well, eating disorders can affect any group of individuals. However, statistically, it's found in higher socioeconomical groups, usually with white females, athletes, and dancers. However, I must emphasize that anyone, male, female, there's no gender, no race, that this disease or disorder discriminates. However, it's just more prominent with the higher socioeconomical groups.
Why would that be?
So I think it's probably based on peer pressure, stress, wanting to look a certain way, wanting to be successful, a certain image. This is what people are striving for. We have, again, like the fashion industry, they have a certain, the designers design clothes for a certain image, especially for models. If you look at the models, they're extremely tall and theoretically anorexic. I mean, they meet the definition of eating disorders. They could be anorexic or bulimic to fit in a certain size, size 0. If you're almost 6 feet tall wearing size 0, you're about 100 pounds, and that's not your ideal body weight for someone who's, you know, anywhere between 5'10", 5'11", maybe even 6 foot. That's typical for models, for runway models. So the pressure of the industry itself. We also have the magazines, you know, that define what a beautiful woman is. I'm going to use female in this case. And they define this is what a beautiful woman is supposed to look like. Well, who set that definition? So again, that's peer pressure from the industry itself, and the industry could be designers versus the manufacturers that cater to a certain image, but that's not reality.
Okay. Now, what is anorexia?
Okay. Anorexia is defined as an individual who goes on a starvation diet. Again, they starve themselves down and their body weight decreases to less than to 15% below their ideal body weight. So it's a starvation diet.
Now, there's some people who does everyone that goes into that starvation diet think that they're going to be anorexia at any particular time, or this is just striving for something?
I don't think that the individual, and I was going to say patient, but because they could potentially be a patient of mine. Right. I don't think their intention is to become an anorexic. However, it's the process for losing the weight. That's the point. Yes, that's the key point. It's the process of losing that weight. It gets to the point where the person will do anything to lose the weight to fit a certain image. If the image is a popular entertainer or so-called role model, they will do whatever it takes to lose the weight to fit into that particular clothesline, particular clothes that is the fad of the day, and unfortunately it could develop to the extreme into anorexia.
All right, now what is bulimia?
Okay, bulimia, again, that is another eating disorder. Bulimia is what is characterized as binge and purge. Binge would be when a person eats to the point where they are full, then they go into purging. Purging can be either by forced vomiting or it could be through the use of enemas, where they purge the food either through vomiting or through having a bowel movement. And this, they would do this several times a day.
Right, and some people take laxatives almost every day.
Yes.
What are some of the signs that a person is doing that, is making themselves vomit? Are there things that you could look at that show signs that this is going on?
Yes, there's always telltale signs. The key is to pay attention and be aware. Telltale signs for bulimia in this particular case would be buying large amounts of laxatives. That's very obvious. A laxative could be in a form of liquid or actual I'm going blank on that.
Yeah.
Where they use an enema, a suppository. There we go.
Suppository,
I
right.
had to pull that out.
Right.
An actual suppository. So if you're noticing a lot of suppositories or liquid laxatives, that's a clue. Unless they have some sort of GI complaint where they're seeing a physician for that and they're on that medication and it's prescribed. Another telltale sign would be that they're having increased dental caries or dental cavities, or they're having changes or problems in their enamel, specifically their front teeth. The enamel from the acid from their stomach, from the vomiting, starts to break down the enamel itself, and they start to develop cavities. Their also telltale sign is the dorsal surface of their hands. They're around their knuckles. From reaching in to vomit, you're forcing yourself to vomit. When you insert your fingers, you will force yourself down and you will cut yourself from your top teeth, and you'll start to see nicks or scar tissue start to build up, or callus formation from the constant and chronic vomiting.
Right.
Those are telltale signs.
Yeah, when I was in high school, I had some classmates that used to think that was a real joke, that they can vomit, make themselves vomit almost automatically. And it was amazing. And this was a practice. They probably didn't even know what they were really doing, except for the fact that they were doing something that someone else couldn't do.
Right.
But there are people that actually do that for the purposes of losing weight.
That's correct. And one last telltale sign with the bulimia, someone who eats a lot and then immediately runs from the dinner table to the bathroom. So that would be, something to be aware of, to watch out for, besides the other telltale signs that I just mentioned previously.
Now, there are complications in all of this, and especially in these two particular areas, anorexia and bulimia. What are some of those complications? And folk need to really understand, by doing this, you're going to create a problem.
Right.
You want to go right ahead?
Yeah, well, complications can be, again, psychological, as well as physiological or physical, where we have changes in the body tissue themselves, as well as metabolic. I'll break down each. Again, the psychological, the person can develop what we call a body dysmorphic syndrome, where their self-image deteriorates, where when they look into the mirror and they see their image different than what it really is. That's important. So when they look in the mirror, they might be skinny, but they're seeing themselves as still being fat. And this propagates or propagates this continued self-mutilation through either anorexia or starvation, or through bulimia, the binge and purge. So that's called body dysmorphic syndrome, where their self-image, body image is changed, and where again, it's not positive, it's a negative image that they're seeing. Where
I don't like the way I look.
Exactly.
People say that, I don't like the way I look.
Right.
I don't like the way my body is shaped. I don't like, women say that, I don't like the way my hips are like this. I don't like, and they keep saying that, and until they begin to do extreme things.
That's correct. And again, this would be to the extreme. The second would be the physical attributes that the individual would have difficulties with, or changes or pathology. This would be muscle wasting. Our body requires energy in the form of input, and which would be food. Our input versus our output. Okay, input would be the nutritional support that we're given versus the output. The output would be the exercise and everyday daily living. When our input decreases but our daily expenditure or output still persists or even increases, then we need to get energy from somewhere. So that energy will come from our fat deposit, the fat stores. We will first burn through all the sugar that is stored in our body, and that would be in the form of glycogen. And then we will go to our body fat. We'll start to break down the fat tissue, the adipose tissue, for energy, which is normal. We'll also burn muscle tissue for energy as well.
Okay.
The body. I'll just finish this. The body will crave the energy, and then will start to break itself down, which is not good. That is pathological. Then we start to have other metabolic problems, and then we start to have organ failure, because we need these processes that are in balance in order to function.
In mind, knowing that through it all, He is there with us. And when you get I can do